wonderful song to lead into this segment. If you are having trouble toning your arms, it's okay to drop the dumbbell. Now there is an exercise-free approach that will have you sleeveless just in time for the summer. Here to support your right to bare arms, America's favorite dermatologist, Dr. Tess Mauricio. Great to see you today.
It's fun to be here, and I wore my sleeveless because, you know, we're approaching spring and summer. And the message is, if you've ever had any issues about your arms, it's, you know, forget about it. There's no excuse. You can buy the right to bare arms for sure.
I love it. And you know, some people go to the gym and do all the workout, and it's a genetic thing. I mean, simply you work hard and you can't get rid of it. So you have a solution for us that won't make us sweat quite as much as the gym.
No, and also when we take care of the problem, and a lot of times, like you said, it's genetic, and it's just fat deposition in the areas, and as we all get older, we do develop that, and then, like you said, your grandma used to call that bat wings. Where it's just hanging. You're doing the double wave, is what my husband said. You're waving here, and then you're waving down here. And it's so simple now. The procedure is liposculpture, where I'm actually creating tiny little incisions. I hide it. There's no visible scar. Hide it on the elbow, hide it around here. And this is a before and after. And this is a lady who has been tired and never had thin arms her whole life, and she said, I'm tired of it. Let's take care of it. One treatment, and this is liposculpture, and you can see in the after, that's 1 month after, much slimmer arms. And this is in the after. Now if she starts working her triceps and biceps, she actually will start seeing the muscle definition, and she's going to get encouraged. She's going to look toned. Here's another patient where that's, you know, those are some bat wings there.
Yeah.
And she's,
Grandma, is that you?
Exactly, but the sad part, she's only in her 40s. But she said genetically she's had this, and there is a misconception where you think, wow, if we remove the fat, if we sculpt the fat away, is the skin going to hang even worse? With now the technology where we're combining lasers and ultrasound to tighten the skin as I'm sculpting the fat, you saw in the before and after, the skin actually retracts and you get a nice definition. And then for patients where it's not the fat, it's not the, you know, no fat problem, it's really just loose skin, and this happens with chronic sun exposure, a lot of the tanned patients that we have, and also just thinner patients where it's really skin. There's a procedure, non-surgical, called VeloShape, and we've demonstrated that here many times, but you can definitely use it for the arms. It's a series of treatments, but it's just an office visit, and you can see it tightens and tones.
So if people are watching, men or women, because you know it can go for either sex.
Right.
The difference between the liposculpture and the VeloShape, one is you're getting rid of the fat, the other you're getting rid of the skin.
The VeloShape is tightening and toning skin. Sometimes, many times actually, we use them in combination, because then I'd go in and we'll do the liposculpture procedure. I sculpt the thing that you can pinch, and then afterwards they want extra tightening and toning. Then we go and treat them with the VeloShape in the office. And so, you know, and it makes such a huge difference, especially for us women. And we're talking about outfits, summertime.
Yeah, I mean,
it limits you.
There's so many cute outfits, but you know, you're showing your arms, and if you're not confident about that, you're not going to exude that confidence.
Exactly. And the arms, I think, is one of the most important body parts, because you can cover your abdomen, you can cover your hips, but the arms, it really, you know, the way you're shaped as a woman, that's so important. And nowadays, the hope, there is hope. You don't have to be born with great arms. After 40, after 30, if your arms are a big problem, it's a simple procedure. It's done under local anesthesia. You don't even have to go under general. And now we're having this amazing offer, and this has been very popular. It's our most popular procedure, $500 off. Liposculpture procedure over $4,000. Just mention our San Diego Living, and you'll be ready and showing off your arms.
Great. So if we do that, then we'll look exactly like this, right?
Yeah, close.
Okay. I love it.
But right to bare arms, and you know, show off your arms. Spring and summer will help you get there.
I love it. And as far as the healing time, some of it looks instantaneous.
Yes. With VeloShape, most patients will feel tightening within the first or second treatment. The great thing about liposculpture of the arms is that it's a permanent procedure. You do it once, you do it with the right surgeon who knows what they're doing, and this is a part of the body that I specialize in, and it's one time. And it's all taken care of. You're free. It's so liberating.
Hey, and your wings won't flap.
That's right.
Dr. Tess, America's favorite
Always
dermatologist.
a pleasure.
Thanks so much for coming on
Great.
today.